You're listening to Streetside, the Street Medicine Institute Student Coalition podcast.
Hello and welcome to Streetside, the official podcast of the Street Medicine Institute Student Coalition. I'm your guest host today, Michael Brennan, and we are at the International Street Medicine Symposium in Kansas City, Missouri, and we're going to be interviewing the participants in the symposium to see what they learned from this gathering.
I'm KK Osman. I'm the founder and CEO of Care Beyond the Boulevard, also the host for the 20th Annual Street Medicine Symposium here in Kansas City. I have learned so much during the past few days. I think that this symposium always does so much to bring us together, to reinvigorate us, to give us new ideas and new thoughts about what we're doing, what we can do, and what other teams are doing, and also what doesn't work for us. One of the big things that I'm taking away from this is that we have a huge family of other street medicine providers. We have a huge amount of resources, that we have other people who are doing these things and that we can reach out to them. We met with the Midwest. We had a big group from the Midwest group. Different cities came together. We've never done that. We did that one day over lunch. And to just hear other people here in the Midwest talk about what we're doing, things that are really unique to us, that maybe, there's a bunch of providers on the East Coast. There's a bunch of providers in California and Texas, and they get together. They have a California Street Medicine Symposium, and they have a Texas one. But in the Midwest, we're a little bit more spread out. And what I learned is that everybody wants to learn from each other. They're so appreciative of the work that each of us are doing, and that we are really a big family who wants to come together, who wants to continue this work and build on the work that each of us have done.
Dr. Carl Grant with Care Beyond the Boulevard in Kansas City, Missouri. I'm a staff physician with them, and what I've learned at the conference this week, which is the first one I've ever attended on street medicine, is that we have a mission, and it appears that everybody is on the same page with the mission of taking care of these homeless patients and getting their medical and psychological needs met. All of the conference has been excellent. Have learned way more than I should have learned, and I'm happy to be here.
My name is Courtney Simanowitz, and I am a paramedic, mobile integrated health paramedic with Lawrence Douglas County Fire Medical in Lawrence, Kansas, not too far from here. And a lot of takeaways from this conference. The main one is treating our frostbite victims. We're headed into winter, and I'm really excited to take what I learned here in the frostbite lecture, specifically managing those wounds, wrapping them correctly, making sure that they're not too tight, making sure that we allow for that swelling that's going to occur. So very good takeaway for me to take back to the field.
I'm Nicole Helmke, and I'm from Durham, North Carolina. I'm the director of a healthcare for the homeless clinic, and I'm a physician. What I learned at the conference, I really enjoyed the talk about climate and people experiencing homelessness. It made me think a lot about the kind of provisions I might need to think about for my patients in extreme weather events, and maybe even how to change prescribing, and some considerations that hadn't really crossed my mind before. So I thought it was a great talk, and I really enjoyed it.
Hi, I'm Lindsay Burson. I'm a family nurse practitioner coming here from Clearwater, Florida. This was my first symposium. I absolutely loved it and learned so much through the experience. I learned about the mortality statistics surrounding homelessness, and also women access to care on the streets. And I do street medicine as my everyday job, and I'm going to take that information back to our program and see how can we address those barriers to care, what can we do differently in our care to better serve the population that we're serving with consistency.
My name is Gustavo Martinez. I'm with Care Beyond the Boulevard here in Kansas City. We serve both the Kansas and Missouri sides of the city, and I work on the administrative side as well as in our development department, and just kind of doing things everywhere in the organization. This is my first street medicine symposium, so I've done a lot of learning. I am new in my role, so I'm still learning a lot about the street medicine efforts worldwide, But the thing that stood out to me the most is just the level of care and love that all of these organizations have. Everyone is in it for the right reason, and that's really inspiring to me to just continue to do what we're doing.
My name is Paige Donahue. I'm a registered nurse with Mount Carmel's Street Medicine program in Columbus, Ohio. And one of the things I loved learning here at the Street Medicine Symposium was the different approaches providers take to promoting autonomy among our patients, especially ways that they ethically evaluate how we can best support our patients' autonomy and safety at the same time.
Hi, Melissa Burgess. I am the HIP Bloomington coordinator from Indianapolis, Indiana. And what have I learned? Wow, so much. I think I learned the most important lesson was how do we integrate social workers into our street medicine team and the value and the role that they play. I'm also a social worker, so trying to figure out what that looks like, coupled with the medical and psychiatric care, and then also how licensed clinical social workers can diagnose and play a critical role for that.
Hi, my name is Meida. I'm a second-year medical student at UC Davis in Sacramento, and I am one of the co-directors for our student-run clinic there, which does mobile outreach. So I think one of the biggest takeaways I've gotten from this conference is just the challenges of coordinating care across, for example, in Kansas City, across state lines when one city belongs to two states. And how those states may sometimes have different rules. I also learned about a similar situation in Ottawa between Quebec and Ontario, so I feel like that was just hammered home for me a couple times.
My name is Sam Gill. I'm from Spokane, Washington with the Chaz Street Medicine team. I'm a program coordinator and medical assistant for our team. And I learned that we should be grateful for the resources that we have in Spokane, because a lot of the places around us don't have good laws in place to protect our patients, and the community partners that we work with are great resources to have.
Good morning. My name is David Klee. I am the lead physician for our Traverse City Street Medicine program in the northern part of Lower Michigan. One thing that I took away from this conference is the ever-changing drugs that are out on the street, and the importance of knowing what's in our area, and so we're able to direct care appropriately. In particular, xylazine, and how that has been rampant throughout the country in approaches to treatment that we're going to take back to our team.
My name is Justin Jackson. I'm from San Francisco. My program is San Francisco's Community Health Center Street Medicine. One takeaway I've gotten from this symposium, I would say, is the utilization of peer support. That job title, we haven't done that yet with our program, and I feel like they make a great impact. They make a great difference in the work that we do on a day-to-day. So I'm definitely wanting to pitch that to my team when I return.
So my name is Dr. Mo, and I'm the Executive Director of Midwest Street Medicine in Sioux Falls, South Dakota. My biggest takeaway is that we are all in the same space doing the same thing, but each and every one of our teams has so many different barriers based off of our geographic location that all of us need to be together and stay together in this space to learn from each other what worked, what didn't work, and be able to lift each other up in those areas as well.
My name is Maria Matsuda, and I'm from Waterloo, Ontario in Canada. The things that impressed me, the one thing that impressed me the most is finding community, and that there are other people that think the same way about what the homeless community is all about, and just the resources and folks that I can call upon for different things. The one project that I was very impressed by was one actually also from Canada. It was a poster on women's health care in pregnancy and getting beds and funding for doulas, and that's something that I hope to really recreate where we are. The other lecture that I found surprisingly interesting was the one on climate change, which I thought might be an empty sort of lecture, but it was really profound and also extremely practical.
Yeah, g'day. I'm Ed Poliness. I'm a GP, so a physician, family doctor in Melbourne, Victoria, Australia. I work at a place called The Living Room, which is an integrated, homeless care. So it's, a combination. So we have like legal on site. We've got the medical, side. We've got Centrelink, so you can get your unemployment benefits and housing and various other services all in the one area, and we all do a bit of outreach from there. It's a great program. I love being part of it, and I love coming to ISMS every year if I can. It's quite a big trip. I think one of the things, so I've been playing along with the Living Room for the last 14 years as part of teams. One thing I really enjoyed discussing at this conference, and I will take home and really unpack a bit more, is that we're like lots of services, the turnover of staff is enormous, and one of the things that we have in the past focused on is a bit of resilience, rather than looking at one thing that keeps people in working with people experiencing homelessness is curiosity, is just meeting each patient and being curious about their lives, and also curious about how can we make these things better, which services you want to use.
Hi, my name is Laura Saturansky, and I'm the Director of Prevention Services at Vivint Health in Kansas City. We do HIV and STI testing, and we've had the tremendous honor to work with Care Beyond the Boulevard for several years now and go out into the community. This past 3 days of learning have been really great. I really enjoyed the session about social justice. I think that there were really great tools that we learned there that we can use on our everyday work with folks.
My name is Seth Campbell. I'm a physician assistant and the program director for Valley Health Partners Street Medicine. We're located in Allentown, Pennsylvania. And for something, I learned, I really like the idea of the red pen and the yellow highlighter, because, having those conversations and having, a plan if things kind of go awry is very important, because sometimes things can be unpredictable.
Explain it.
So in the red pen, is a up and out, and it's something simple that you can ask your team members, and it won't raise flags for folks that are there. And a yellow highlighter is, we got to get scooting in a couple minutes here, because every day's your first day when you go to camp.
I'm Alice Inouye, a physician in Seattle, Washington, and the volunteer medical director with Operation Night Watch, which has been serving the Seattle area for over 50 years. They just started wanting medical outreach this past May. Coming to this conference has been an inspiration for me, having been in medicine for over 50 years and seeing the brokenness of our system. It's been incredibly giving me a lot of hope for the next generation of providers, seeing all these young people inspired to do the right thing, to care for people the way they need to be cared for, and to stand in the gap against, to me, all odds for people who are most frail and vulnerable. So just can't thank the conference and all the people behind it enough.
Hi, this is Yvette Perez, and I'm with USC Street Medicine. I'm the clinic nurse manager, and this is the first conference I've been to, but I would like to say that I have truly, truly seen what amazing people that are working in street medicine there is, and just how much everyone cares about what they do, which I've been in the nursing field for over 15 years, but it's just amazing how much everyone cares about their patients and street medicine.
Hi, I'm Julia DeZiel. I'm the recruitment coordinator for the Smith Student Coalition, and I go to West Virginia University School of Medicine in Morgantown, West Virginia. One thing I learned this week is the importance of climate resilience for the future of street medicine. I went to a really amazing talk about a program in Shiprock, New Mexico that serves the Navajo Nation, and it's a perspective that I had not considered for the future of street medicine.
Hi, my name is Safia Rubai. I'm a longtime emergency physician at Gallup Indian Medical Center with the Indian Health Services. And I'm also a nurse, a longtime nurse. And the main thing I learned from the conference is that there's this wonderful group of people who are actually putting their love and compassion into action. And we're planning on starting a street medicine program in our area next year. And I clearly have this huge community that's already been there, done that, and is excelling what they do. And what I really learned is that this love and this compassion for people can be put into motion in working with our most vulnerable populations. So that's what I'm most grateful for.
My name is Brady Rose. I am the production manager for the AV company running all of the background support for the Street Medicine Symposium. I'm a Kansas City local, and what I've learned here in my time here, since I've been sitting in on so many of the sessions, is just how much heart all these people have and the compassion that they have to get into these roles in these fields, and it's just really cool to see how much everyone cares about it.
Beautiful.
Hi, I'm Maureen O'Day. I'm an RN from Columbia, Missouri, and I got involved with our mutual aid group, COMAC, Columbia Mutual, our Mobile Aid Collective, which started as a food and water supplier because we saw the need in our community of 150,000. And we developed more of a street medicine angle during the time of COVID, and just pretty much improvised, did wound care under a tent in a church parking lot, and now we're under a pavilion and looking for more of a structural, more structural stability for a clinic. But I love this street medicine conference. It's my first, and I just came from the wound care presentation, and I was very excited to learn about xylazine and wound care and another clinic, but my main concern is that xylazine wounds are being seen frequently in St. Louis, which is only 2 hours east of us, and so we're very interested in getting a jump on this problem before it worsens.
2, 1, go.
Hello, my name is Joel Hunt, and I am the Director of Acclaimed Street Medicine in Fort Worth, Texas at JPS Health Network. A few things I learned at this year's International Street Medicine Symposium was some reframing of the way to interact with patients and think about how we do what we do. And one thing was to be the checklist and not do the checklist. I think that's a quote from Corinne Feldman. I love the framing of that, the breakdown of reframing, and it's a great way to tell people to how to do that in a succinct way. I really like that. Something else I learned from I think it was one of the Dr. Coles is just another interesting perspective shift of how we focus and lead our care of patients, and putting, is it patient care, insurance care, metric care, or lead, metric-led care, insurance-led care, patient-led care, and I like the succinctness of that in the ways that we talk about how we do what we do in terms of program design and in the bigger picture, and keeping patients at the center of what we do.
My name is Jackie Lamer from Kansas City, Missouri. I'm a volunteer with Care Beyond the Boulevard. And the one thing I've seen here at the Symposium, 20th Annual International Street Medicine Symposium, is the universality of the need for street medicine. We need it here in Kansas City, but all of the visitors from around the country, around the world, are saying the same things. Same story, slightly different approach to solving these big problems.
My name is Jonah Elyashar. I am a third-year medical student at the University of Kansas School of Medicine, and I work with the street medicine team Care Beyond the Boulevard. This year's conference really helped me reflect on the different types of work that all of these street medicine teams do. And what I find most valuable is, despite everyone being in different situations, having patients living in different places, experiencing similar things but in different ways, we all find ourselves managing our patients very similarly. We go out into camps, we pull up on the side of streets under bridges, and we bring the care to the people. We are not reliant on the traditional setting of the medical and healthcare system to provide those medical concerns and figure out creative ways in which we can truly help our patients, whether that means just showing up the same time every week or building that relationship and trust so that the patients who were once hurt by the medical system currently in place can now rebuild that relationship and get the care they need.
The opinions expressed in this podcast are those of the individuals included and are not representative of the opinions of the Street Medicine Institute or the Street Medicine Institute Student Coalition. Do not use this podcast as medical advice and instead see your own provider for medical